So I have a doctorate from the University of Washington School of Public Health in environmental health, and I am also the professor that teaches epidemiology at Boise State University.
Fantastic. And for those that's a big word for epidemiology, that is the study of
epidemics.
There you go. We're kind of in the middle of one, or a pandemic in this case.
Exactly. Yeah, it's interesting. I've always had to explain what that word means, and suddenly everybody I talk to knows what I do now.
Right? So there's a lot of stuff in the news, and the purpose of our conversation really is just for clarification, because there's so much that comes out. Is this true? Is that true? I don't even understand what they're saying. Flattening the curve, the transmission rates, the spread of the disease. Can you bring some clarification for us, Cynthia?
Yeah, I'd be happy to do that. So I think one of the main questions that people have, that people are asking each other is, why do I need to stay home right now when I'm perfectly healthy? Why do I need to, make sure that I'm staying 6 feet away from people when I don't have any symptoms and there's so much work that needs to be done? And I think the main thing that, the media is trying to talk about, but that sometimes gets a little complicated, is really this idea of flattening the curve. I'm not sure everybody even knows what curve we're talking about. So one of the things, when I teach epidemiology to undergraduates, it's actually one of the things we talk about in the first week of classes, the epidemic curve. And what it really is a graph. It's time on the x-axis on the bottom and number of cases on the y-axis on the side. And so every day, as we hear about how many new cases we've had, basically when you make a curve like that, you're making a bar chart. You have like a little bar. I wish I had images on the radio here.
Right.
You make a little bar of how many new cases there are. And so when we think about that curve, the more new cases you have on any given day, the steeper that curve, right? The quicker it rises. And the problem with a really steep curve is that means a lot of people with illness are coming into our medical system.
Okay.
All at the same time. Right? And it's a finite resource. We only have so many medical beds available. We only have so many ventilators. And so the idea of flattening the curve is just to slow it down, to make the curve a little less steep. That's the flattening part, so that we don't have, doubling of new cases every day and nowhere for people to go to be treated. So the idea of social distancing and staying home and trying to isolate as much as possible is to keep from passing it on to one another. And I think the thing that's hardest for us to understand and really wrap our minds around is the fact that we could be passing it on when we don't even have any symptoms.
Right. And that is hard to understand because, I feel good right now. And, honestly, I feel like I should just be able to go out and live my life. But I get it, because I've heard many times, like you just said, people have no symptoms and can be spreading it to other people before they would even realize they have it.
Exactly. And one of the great things about our ability that we will have to, defeat this virus is that it's actually not a very tough virus. It's not like some viruses like norovirus or like MRSA that are really hard to kill and get rid of. This we can get rid of with hand washing, with alcohol-based hand sanitizers. There's a lot we can do to remove this virus from our surfaces, but it does live on surfaces for quite a while if we don't do those things.
Right.
So the idea of, closing down the playgrounds, well, if somebody touches something and it doesn't immediately get wiped down with soap and water or a hand sanitizer, that can easily pass from, one kid to the next, just as simple as, one kid following the other on the slide. I think we are seeing the same kind of rise in cases here that we've seen in other places. Obviously, we've been lucky to be a little slower in having cases come in, but I saw in Idaho Statesman today that we're at 92 cases, and just over a week ago is when we had our first case. I also saw that they're now thinking that this is community spread, which is a pretty important term. It means that people are passing it, or someone has passed it to someone else, and we don't know how that happened. Most of our, or if not all of our previous cases here in Idaho could be tied back to somebody who had traveled to Seattle or somebody who had traveled to Blaine County, in Ada County here. We could figure out where it came from. Once we start not being able to tie that back, we start to worry that more people are asymptomatically infected than we realized. So I think this is a crucial time for us here in Boise right now. This is really the time to do the hard thing, stay inside, and give our hospitals a chance to react to the people that might be coming in.
Right. And would you say not wait for the governor of Idaho to say, okay, just like Washington, Oregon, California, all these other states that they've made the order to stay at home, that we should just take that upon ourselves and do that?
I think that we have to listen to our leadership. We have to trust, our officials. But I do think that, as much as we can, we already know that we should be social distancing. I mean, everyone is already telling us that if you don't have to go out, try not to. If you don't have to travel, don't travel. If you can stay 6 feet away, you should. So I think that's still really consistent with the guidance that we're getting. And I think we just need to, do that hard thing. It's really, I have a 5-year-old. She's here in the house with me, and it's hard to not want to take her to a playground. She's getting stir crazy just like I am, but this is more important.
Well, Cynthia Curl, thank you so much for spending some time with us. Probably just wrap this up by saying, wash your hands, right?
Wash your hands.
Wash your hands.
Absolutely.